Hi, I'm Dr. Gus Vickery of Vickery Family Medicine. I wanted to take a moment and talk about some of the challenges we're all experiencing in healthcare. Challenges for the patients, for the average consumer, for the business owners who are buying health plans. Challenges for the clinicians and their teams who are trying to deliver outstanding care. It's a very challenging time in primary healthcare. It seems like we're achieving very little. That's not true. A lot of good is being done, and our healthcare system is good at some things, like putting you back together after major trauma. We can do that pretty well. But when it comes to helping people experience their best health and have a great experience in our offices, we're not doing a very good job of this. There are many reasons for it, and I'd like to explain some of them. Our consumers are paying so much for healthcare. It's costing so much out of pocket for individuals and families, and then often covering so little. In addition, the plans are hard to understand, the contracts are lengthy, and it's very challenging to understand what your actual healthcare plan that costs a fortune will actually do for you. And you often find out it's very little. Employers are having to try and buy these plans that cover less because the cost of healthcare is rising so quickly that they can't reinvest in wages, retirement benefits, or improving their goods and services. So it's also really negatively influencing the economy. On our side, those of us delivering primary care, have an enormous amount of compliance administrative burden that we have to deal with just to do what we're trained to do, which is actually consult with individuals and help them make decisions about their health. Can you imagine for a moment if when you came in to see your primary care physician that it was a straightforward transaction like in any other business, that you came in because you had particular concerns you wanted to discuss, your physician took the time necessary to address those to your satisfaction, and then you simply paid for that on the way out the door. Imagine if your physician didn't have to actually spend more time looking at a computer than listening to you. Imagine if you didn't have to fill out a bunch of questionnaires about whether you're going to fall or whether you're misusing drugs or other types of screening questionnaires when all you wanted to do was try and get your rash treated and get back to work. Imagine if the physician's office didn't have to actually go through a lengthy, convoluted process with a big team of people to let the insurance company know that you had been seen and that we needed to be paid for the services, and then actually wait while the insurance company often refuses it multiple times until they finally agree that the charges were appropriate and then pass the bill back on to the consumer anyway. It's really crazy how we're running healthcare. But unfortunately, I don't think it's going to get any better anytime soon. I think we're going to continue to experience these challenges. It's going to be up to us, those of us who are independent family practice offices who care deeply about our work and our clients to work together on the solutions. But the solutions are there. There are so many different influencers of this problem, it's impossible to talk through all of them. But I'd like to mention a few. One is that all of the work when you're using your insurance product is brokered through that insurance contract. And so often individuals don't understand their insurance contracts. They don't often realize that they're on the hook for the entire payment if they've chosen a particular type of plan. Or that services outside the scope of a standard preventative visit will actually be billed back to them. So if they come in for chest pain and feel they need an EKG and they pay their copay, oftentimes the insurance company agrees the EKG was necessary, but it still insists that the patient pay that bill until they meet their deductible. And this just continues on, where there's so much cost shifting back to the consumer that you feel like your insurance company is covering nothing. That's not true. They're there to protect you from catastrophic risk, and some plans do have robust coverage for primary care services. But a large percentage of our customers no longer have that type of coverage. And then the process gets increasingly frustrating because as we work through the billing process and try to prove the validity of our work and our charges, and then the discounts are applied, and then we have to work back with the consumer, a lot of the different conflicting messages happen, and often the customer is actually upset with us because they believe our processes are causing trouble when in fact it's the actual insurance company's contracts that created those processes in the first place. We know there's a better way. We like our patients. We like serving them. That's why we show up to work each day. That's why we come in and why we build good teams. We want to see our patients. We want to care for our patients. Our clinicians and our staff really enjoy the work that we do when it's focused on actually healthcare, true healthcare. We don't always love all the data entry and compliance and paperwork and billing conundrums and the customer service issues it creates. We don't enjoy that either. But we like to actually practice medicine. That's fun for us. We wish we could get back to that where that's all we did. We've never settled for this. Our office over 14 years has innovated in a number of ways. We work in a direct care capacity with the Biltmore Company, and all of their employees have benefited from an on-site clinic that works on a direct capitated payment system that is no charge to those employees at all. It's free to them. And 7 years later, when you look at what that clinic has achieved, it's remarkable. The utilizers of that particular clinic are healthier and happier, and they're very satisfied with their care. And the overall delivery of the care is costing much less to both the company and the insurer. And when I saw how much that model could achieve, I began to see if we could scale that to any business. And we formed a separate company to provide direct care products to our patients. So if the current insurance paradigm wasn't working for them, they could have access to very transparent, affordable pricing and get the care they need. And we still provide those services. When we realized how hard it was for patients to visit an urgent care or an emergency department on the weekend, how expensive it was, we invested in a 7-day-a-week clinic that our patients can walk into. But we want to rebuild trust with our customers that we're in this together, that we'd rather not work with those insurance products. We'd rather just focus on our customers. But we do work with those insurance products because our customers need us to. Most people do have insurance. Most people buy it because they need to be protected from catastrophic risk. And once they've paid for it, understandably, they want to use it. I get that. We have a healthcare plan in our office, and I, as an employer, know the cost of that. And we want our employees to have access to good healthcare. There's over $2 trillion spent on healthcare in our country. And we're not getting healthier as a population. There's an enormous amount of money spent on pharmaceuticals. Pharmaceutical companies are the #1 lobbyer of the federal government. There's an enormous amount of money spent on insurance and insurance bureaucracy. Insurance is the #2 lobbyer of the federal government. And now insurance companies are the pharmaceutical companies are buying the insurance companies. The actual owners of the pharmaceutical supply chain are purchasing the healthcare delivery chain. You can't tell me there's not some conflict of interest there. And the entire system seems to be incentivized towards screening and pharmaceutical intervention, And so an average patient in our clinic is a normal adult who works hard and is responsible. And when they come to see us, it might be for prevention, but they're not just interested in a standard population health algorithmic approach. They want to know how to help them as an individual become their healthiest self. They want to understand the truth of nutrition or sleep or how to manage stress or which supplements they need. And that takes time, but we want to provide that for them. That's why we have videos on a YouTube channel. That's why we write a blog series about these topics. That's why I've published a book, Authentic Health, to teach people these truths, because we want to see our patient population be their healthiest selves so they can go live their best lives. It's really important to us. That's our mission. And I know that human beings are designed well. We're designed for good health. It's not normal for so many to have chronic diseases. It's not normal for so many people to feel bad so much of the time. If we have access to the right information and we can give our bodies the right information and minimize the wrong information, our bodies will heal themselves and become healthy. And we won't need so many pharmaceuticals. We won't need to spend so much money on healthcare. And I know my patients want that. They want to feel good. They don't come in saying I'd like 5 prescriptions. They come in saying I have inflammation, my stomach hurts, I'm tired, I'm having trouble sleeping. And while medication could be a helpful tool to help them feel better while we're trying to figure this out, actually, with the right information and the right desire and the right approach, they're going to be able to improve their sleep, wake up refreshed, that will improve their mood, identify the foods that are triggering their discomfort and inflammation, change their diet, correct nutrient deficiencies, and actually become quite healthy and feel really good. That's our goal for our patients. But your insurance company isn't really providing that. That's not what the kind of care they're providing access to. But we won't settle for that. So we'll have to try and keep doing both. But that puts a lot of pressure on us. And we need a collaborative relationship with our clients and patients. We need to work with patients who are committed to their good health and also committed to working with us through the challenges of the modern healthcare delivery system. A typical patient, perhaps they work in a factory and work very hard, and they've developed knee pain. Well, they finally schedule some paid time off, which is hard to get. They drive across town to our clinic, and they wait, and then they see a clinician. Before they see the clinician, they're asked to fill out screening questionnaires about issues that they aren't even in the office to talk to their healthcare consultant about. And in addition, the screening questionnaires often feel a bit personal, and they wonder, where's that data going to go? I understand that. I share that concern. They finally get into the office to discuss their knee pain, and then their medical provider is supposed to review those screening questionnaires because that's what the insurance company requires for quality reporting. In addition, the medical provider probably only has 10 to 15 minutes, and they need to enter all of the data into the system so they can actually bill the insurance and say, yes, we saw this patient, yes, they had knee pain, and we should be paid for the time we spent with them. Finally, you get to focus on the knee pain. Many areas around this country, all that happens is you get referred to a specialist who's going to actually order additional studies, and it's just going to get increasingly expensive, when all along it was just perhaps a issue of connective tissue tightness or a repetitive motion habit that a few visits with the physical therapist could have taken care of. Now, we want our patients to know that. We want to prevent them from having to go to the specialist. But then that person finally leaves the office frustrated because they haven't really had the experience they were looking for. And then on top of it, they found out they're responsible for the entire bill anyway. And so the question is, why is the insurance company dictating the agenda of my care when they're not even paying the bill?